Welcome back to Elite Nurses channel. Today we are diving back into solving past questions for the NMC examination. If you missed the first video, you can find the link in the top right corner. Don't forget to subscribe and also give this video a thumbs up. So picking up where we left off in the last video, let's move to question 9. Okay, so number 9. The nurse is caring for a client with epilepsy who is being treated with carbamazepine, that's Tegretol. Which laboratory value might indicate a serious side effect of this drug? We have A, uric acid of 5 mg per deciliter, B to be hematocrit level of 33%, the C to be WBC of 2000 per cubic millimeter, the D is platelets of 150,000 per cubic millimeter. Yes, we know that carbamazepine can cause bone marrow suppression, which may lead to decrease in white blood cell count and platelet count. And so if you know the cause of the side effect of carbamazepine, you will not have to look through all these possible answers. We just select the few which is related to carbamazepine. And so let's look at the normal values for the white blood cell count and then the platelet count. We have the normal values of the white blood cell count to range from 4,500 to 10,000 cells per cubic millimeter, and that for the platelet is 150,000 to 400,000 platelet per cubic millimeter. So we know that the platelet is already within the normal value, but there is a significant decrease in the white blood cell. Yes, because the normal value of the white blood cell is 4,500 to 10,000 cells per cubic millimeter, but here it's 2,000 per cubic millimeter. So the correct answer here is C, WBC of 2,000 per cubic millimeter. A 6-month-old client is admitted with possible intussusception. Which question during the nursing history is least helpful in obtaining information regarding this diagnosis? We have A, tell me about his pain. B, what does his vomit look like? C, describe his usual diet. D, have you noticed changes in his abdominal size? Okay, so we know that A, B, and D are useful in determining the extent of the disease process. Yes, so they are incorrect. Yes, but then we have to know the meaning of intussusception. Intussusception is a medical condition where one part of the intestine slides into another part, similar to how the parts of the telescope slide into one another. And so it's a disease of the related to the intestines, right? And so all these you look through the possible answers, you see that describe his usual diet is the least helpful here. Yes, so the correct answer is C. Question 11. The nurse is assisting a client with diverticulosis to select appropriate foods. Which food should be avoided? We have A, bran, B, fresh peaches, C, cucumber salad, and then D, the yeast rolls. Okay, so a client with diverticulitis should avoid food with seeds. Yes, but here we can see that A, B, and D they help prevent constipation, and so they are allowed in client with diverticulosis. But the correct answer would be C, cucumber salad. Yes. Question 12. A client has rectal cancer and is scheduled for an abdominal perineal resection. What should be the priority nursing care during the post-op period? We have A, teaching how to irrigate the ileostomy. We have B, stopping electrolyte loss in the incision area. We have C, encouraging a high fiber diet. We have D, to facilitate perineal wound drainage. So a client with perineal resection will have a perineal incision, yes, and drains will be used to facilitate wound drainage. This will help to prevent infections of the surgical site, and so the client will not have an ileostomy as answer A, and he will have some electrolyte loss, but treatment is not focused on preventing the loss, so answer B is also incorrect. A high fiber diet in answer C is not ordered at this time, so the correct answer is D. Question 13. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low roffic diet. Which food would have to be eliminated from this client's diet? We have A, roasted chicken, B, noodles, C, cooked broccoli, and then the D, the custard. So the client with diverticulitis should avoid eating food that are gas forming and also increases abdominal discomfort. We saw from the first question that clients with diverticulitis should avoid taking food that contains C's in them. Yes, so they should avoid food that are gas forming. Yes, and so the correct answer is C, cooked broccoli. Question 14. The nurse is caring for a new mother. The mother asks why her baby has lost weight since he was born. The best explanation of the weight loss is A, the baby is dehydrated due to polyuria. B, the baby is hypoglycemic due to lack of glucose. C, the baby is allergic to formula the mother is giving him. D, the baby can lose up to 10% of weight due to meconium, stool, loss of extracellular fluid, and in the initiation of breastfeeding. Okay, so we know that after birth, meconium, stool, loss of extracellular fluid, and then the initiation of breastfeeding can cause the infant to lose body mass. Yes, and so the correct answer is D, but there is no evidence to indicate dehydration, hypoglycemia, or allergic to the infant's formula. Thus, A, B, and C are incorrect. Thanks for joining us. This is where we will end our today's NMC past question solvents. And if you are new here and you haven't subscribed, please subscribe and also like this video. Yeah, I'll be doing a video on how to form questions out of slides or notes. Yes, so just turn on your post notification so that when I upload a new video you'll be notified.